everyone. Good afternoon, everybody. I'm Riddhi, your host for today's live from All About Skin Wellbeing team. I'm sure all of you must be keeping in good health. Today, we are going to discuss about a skin healthy with focus on urticaria or hives, which we or our near and dear one would have encountered at some times in their lives. Urticaria is characterized by round rash on the skin that itch intensely. It may due to chemicals in certain foods, allergy to certain medications, insect stings, sunlight, and sometimes the cause is unknown. As per study published in Indian Journal of Dermatology, Venerology, and Leprosy, more than one-fifth of the population suffer urticaria at one time. 60% of patients are in the age group of 20 to 40 years. Incidence is higher in older age group. Urticaria is classified as acute and chronic, but the most important part is not to ignore it, and doing self medication can worsen its symptoms. Consult your nearby qualified skin specialist immediately for an early remission. In today's digital world, it's a boon or blessing if we can get to hear from the expert dermatologist online about urticaria and its types, how we can prevent it, the kind of test required for its diagnosis, the right treatment and management approach for an early relief. So, ladies and gentlemen, girls and boys, we have with us a renowned dermatologist of Delhi, Dr. Chanchal Choudhary, have experience of more than 10 years with in-depth knowledge of medical dermatology, dermatological surgery, cosmetic dermatology, and hair transplant. She did her post-graduation from Dr. D.Y. Patil Medical College, Pune. She has hands-on experience in fractional CO2 lasers, DOID lasers, IPL, Q-switch, NDAG laser, Botox, fillers, thread lift, radio frequency, body contouring, chemical peel, microdermabrasions, derma rollers, cryptotherapy, mesotherapy, ear piecing, fraxel laser, etc. A very warm welcome to Dr. Chanchal Chaudhary. It's a pleasure to have you with us, and today as we are going to discuss about a very important topic, which is the management of urticarial fist. Of all, I would like to ask doctor, what is urticaria?
Thanks, Riddhi, for such a warm welcome, first of all. And yes, it's a very common problem these days, which we are facing day to day. It may be because of the lifestyle modification is there. So urticaria, as you said correctly, it's hives. It's actually the inflammation of the skin, okay, along with the redness around that inflamed skin. And so this is known as the wheel, basically. The wheel is appearing. The patient comes, there is a edematous skin, or there's a little swelling in the skin and slight redness, and there's a lot of itching, right? So this is the symptoms the patient comes with. And what we diagnose is there is a wheal formation. When I say wheal formation, it's a little swelling of the skin, along with maybe their red flare around the skin. Okay, so this is basically the this symptoms, and the diagnosis is known as the urticaria cause of the problem.
Doctor, what are the main causes of urticaria?
So said is hives. Hives is something allergic. So this why this hives word or urticaria word has come from is basically it's an insect bite. So it's an allergic reaction. It's happening to certain ingredients. Now, if you ask me, we have urticaria of two types. One is acute urticaria, where initially the patient takes some sort of allergen, is allergic to, and within a minute, it develops some sort of allergy, okay, which is known as acute urticaria. Now, the patient may have some sort of, allergens for a long time exposure, and gradually he develops some sort of autoimmune allergen, which is known as chronic urticaria. So the cause is broadly confined into acute, whether it's within a minute you have developed, and we have to go from the history. What could be the cause? Is it the drugs which may be the cause? It may be the food allergen which may be the cause. Maybe sometime it may be the infection. Even the COVID infection. If you have maybe the first symptom which patient has an urticarial reaction. So acute viral infection, acute bacterial infection sometimes can even be an allergic reaction. Okay? So patient comes with an acute allergic reaction in these cases. Even ingestion of a medicine which you're taking can develop an allergic reaction to it. And of course, the cosmetic use is very common these days. So any kind of cosmetic or maybe the ingredient in that cosmetic is an allergen, then you can develop the immediate acute urticaria. Okay, so these are the main common cause which I can really rule out for an acute urticaria when a patient comes to me. The doctor, I have an allergy, I have an itching, and a redness. So this is the main cause.
Doctor, how does urticaria look like? Is it an allergy or something?
So basically, for the patient, the first symptoms in itching. The patient comes with intense itching, and suddenly the patient notices that is developing swelling on the skin. The swelling may be all around, or swelling may be to particular area, and there's a redness also. So patient get really panic that it's developing itching and red rashes, and patient these are the main symptoms the patient came with.
Doctor, because of the itching and inflammation and the swelling, does it happens like doing icing will work out?
Certain cases, not to all, you know, because there's something called physical urticaria, in which patient is allergic to cold ice or maybe the cold air, or
Mhm.
so in that cold water. In
Mhm.
that case, it might get aggravated. Otherwise, if you're putting in ice, in some patients they do say that they get relief from that.
Doctor, is urticaria a serious disease?
Yes, if not treated properly. Yes, definitely. Why? As I mentioned, it's acute when you're developing an immediate symptoms, but gradually in some patients, it may give rise to swelling of your internal organ sometimes, it is known as angioedema, in which the swelling may goes deeper, not only on the upper skin, way to the dumbness, to subacute level, and the swelling is bigger swelling,
Mhm.
and sometimes it may can affect your throat, or you can be associated with wheezing problem, breathing problem if it is involving your oral area, you know. So yes, it has to be taken before it's become little severe and we have to take a patient for that anaphylactic shock or an angioedema. It's important to treat your acute urticaria at the very starting phase.
Does urticaria become chronic if not treated on time?
Yes. So when we call as acute urticaria, it's because of duration. If it is less than 6 weeks, it's called as acute urticaria, like 1.5 months. If it is more than 1.5, more than 6 weeks, then it
Mhm.
becomes like a chronic urticaria. Treating acute urticaria is very, very easy as compared to treating a chronic urticaria, which becomes like you have to take a treatment for a long time. Okay.
Okay.
And also in chronic urticaria, as I said, autoimmune also plays a role, major role there. Then we have to deal with that for a longer time. So better to treat your urticaria at a very early stage, so that you should not, just go lag with that chronic urticaria for a long time, maybe sometime for years. It's better to treat it very, very early stage.
Doctor, how can one identify that they have a disease called urticaria?
The patient cannot identify. Patient just comes with an allergic reaction. You know, yes, patient doesn't know that's it. It's known as urticaria. So what the doctor will diagnose.
Yes.
So it's just the allergy for the patient, but it's not actually an allergy. There's certain pathophysiology which is happening there, okay, because of the allergen, and the patient is repeatedly getting those, allergy reaction. So if you're getting repeatedly allergic reaction, it's a time to see a doctor instead of just taking some medicine and get relief from the allergy.
Doctor, what are the chronic urticaria hives and how will they go away?
So when we talk about chronic urticaria, there are two types of chronic urticaria, which are known. Some which is caused by some irritant. Okay, so the one is inducible chronic urticaria. For example, I'll just explain you. If you have been exposed to excessive heat, right? So patient also started itching. Okay, so this is sometimes known as heat urticaria. And second is patient has exposed to, as I said, cold air, cold ice pack. The patient can start developing itching or sneezing. That is known as cold urticaria. Second is sometime if you are sweating a lot, even after like doing gymming or sweating, any other cause of sweating is there, you can get cholinergic urticaria, we call it, because of sweating induced urticaria. Even in some patient, if they scratch too much, they develop some sort of pattern in their skin, which is known as dermographism, physical urticaria.
Yes.
That is there. Even excessive vibratory, if you use any vibratory, instruments, patient starts developing that urticaria, itching, known as vibratory urticaria. So there are
Mhm.
many causes of it. So these are the different form of chronic inducible urticaria. And there is something called as chronic spontaneous urticaria, which is the most common one, in which basically no known causes. We cannot say why it's happening. Patient doesn't know, "Ma'am, okay, why this is happening to this, because in
Mhm.
autoimmune it's happening." And the patient has this, we call it an idiopathic urticaria, chronic spontaneous urticaria. Okay, so basically these two types of urticaria.
Mhm. Doctor, when one should seek a doctor and go for a emergency care?
So, see, emergency care is basically when you have a lot of itching, okay, and intense itching, and also you are not able to breathe properly, okay. Then it's especially and not able to breathe, and you can see a lot of edema around your eyes, around your mouth, your swelling is visible, and
Mhm.
so it's a better time to just visit a doctor immediately or a hospital, and look for a, so that they can treat you immediately instead of get you look, go into anaphylactic shock and endure.
Doctor, what are the potential complications of urticaria if left untreated?
So as I said, so if you're having a lot of itching, okay,
Mhm.
followed by developing a swelling gradually, okay. So gradually, maybe it starts with face, mostly starts with face, that is around the eyes, around the mouth, and then it's going to your oral area as well. And if there's a breathing difficulty, so you have to immediately go and see your doctor.
So complications starts from the
Complications start
eyes.
with the eyes. Yes, swelling is there. The in
Mhm.
itching it's keep increasing. Fine. And one more complication, as I can see, as I said, you are allergic to cold air, and
Mhm.
somehow you're not protecting yourself from cold air. So immediately you start developing that.
Okay.
Difficulty in breathing,
Mhm.
swelling all over, and intense itching.
Mhm.
So these are the basic. If you not take care of your what is the cause of your allergy, then it's
Yeah.
aggravated immediately. Sometimes excessive sunlight exposure as well can
Mhm.
lead to complication. Intense itching, redness, and it's spreading to your whole body as well.
Mhm. Doctor, sometimes it happens that if any of the individual feels allergy, rashes on the skin start scratching, they visit their family doctors. In the most of the cases, if they find some kind of allergy, which doctor they should consult because they don't know what kind of rashes or allergy they are facing. So, what is recommended by you?
So if it is, as you said, it's an emergency, better to each doctor as near to you so that they can take care of the emergency.
Okay.
Once you've been clear of the emergency, then you should meet a dermatologist
Mhm.
because I have seen most of my patients. They
Mhm.
have gone to different doctors. Not they're just been diagnosed with allergic reaction, but once they reach the dermatologist, we actually tell them that it's not just plain allergic. This is known as urticaria. I have many patients which has just come with allergic reaction, a lot of prescription there. So I think
Mhm.
dermatologists are the one which actually able to diagnose the urticaria,
Mhm.
or a physicians maybe
Mhm.
we can really look for this urticaria.
Yeah, it is very common where any of the individuals had a food intakes and they have allergy reactions, they immediately visit to the physician and they get medicated. So after the treatment, one should, I seem like they should visit once a dermatology if they are facing any of the allergy, you seem to say, right?
Repeated one, repeated one. Yes,
Yes,
I've
yes.
seen many prescriptions like this.
Mhm. Can urtica can be caused by stress? If yes, then how do stress urtica look like?
Stress cause everything. Not just urticaria. I will not say that stress isn't like it can enhance your urticaria. What I can say that it's not
Mhm.
just a particular stimulus of urticaria, but it enhance. If you have allergic reaction, it get enhanced by the stress as such.
Okay, so stress is something which is going to add anything. Like if you're diagnosed with anything, stress is going to add more on it.
Yes, definitely.
Okay, and same goes with urtica as well. So why do hives or urtica get worse at night?
So because the patient are more relaxed at that time,
Mm-hmm.
yeah, and their mind is like, so they start feeling more of itching at that time, relaxing time. It's a itching
Mm-hmm.
there at that time also. So and muscle deregulation is more in the after 6 p.m. it's been seen. So basically it's seen at that night. So both the factor will be there.
Is there any dietary precautions or do's and don'ts for patients of urtica?
See, when it comes to do's and don't, important thing is if you know that you are allergic to this drug, or maybe because of certain factor like heat, cold, UV rays, any food, if you know that allergic, then avoid that. Okay, that is important. And so basically, take, and if you are on some medication, follow the medication till the doctor will say to you, you know, this medication has to be taken for the urticaria I'm talking. So that you have to get it.
Doctor, what urticaria causes flare up?
So flare up can be because of, as I said first initially about acute urticaria. Okay. So see, we are eating outside. If we are eating outside, there's a lot of preservatives are used in the food, even the oil we are consuming. So that may be the factor for the flare up of the urticaria. Also, if you are allergic to, as I said, to all physical cause of urticaria, then it gets flare up. Even sometime, insect bite. If you have an insect bite, then can also start as a flare up of your urticaria. Fine. So basic. Even smoking alcohol can also aggravate your urticaria. That is also one of the factors. So, and if it's an autoimmune, even I've seen in if you have an autoimmune problem like thyroid, SLE, sometime even these can be the reason for flaring of our urticaria. So when we take a history of a patient, we see all the causes why. As I said, some infection can also flare up your urticaria. So that is also you have to keep in mind. So these are the different causes, and even the cosmetic. Sometimes even cosmetic can flare up your urticaria. So any cause we have to rule from the history can be the reason for flare.
Okay. Doctor, as you mentioned about the food, which food one should avoid if one is diagnosed with urticaria?
So normally, it's very difficult sometimes to see which food is giving you an allergy. But we do something called skin prick test, in which we try to evaluate some foods. Okay, so which is we test positive in your skin prick test. So we ask the patient to avoid those food. Also, sometimes we tell the patient to do if they feel that such some foods are giving them the allergic reaction. So we ask the patient to introduce it gradually and see whether that particular food is giving an allergy to it. And basically which gives an is like the azo dye colors, the colors used in the food material are the main cause for food allergens,
Mm-hmm.
or the preservatives which are used in the food is the main cause for the allergens.
Yes. Doctor, what infections cause urticaria?
So any acute bacterial infection can cause any sort of bacterial infection. Acute viral infection can also cause the sometimes even helminthic. If you have the worms infection in your stomach, can also cause an urticaria reaction. So any sort of even fungal infection can also give you itching and urticaria flare up of your urticaria. All sort of infection can be the starting phase of your as an urticaria.
Mhm. Doctor, how do we treat urticaria?
So for treating urticaria, first and foremost important is the history.
Hmm.
Okay, we take a proper history of a patient since when the patient is suffering, the time of onset, and whether the rashes are seen like in urticaria, the rashes they comes and goes. It's like on and off, right? So it is there for a few hours and then it fades off. So we will ask how oftenly they are seeing this phenomena is happening. In some of them, the rashes may reign for more than one day, 24 hours, but normally the rashes comes for it remains for a few hours and it goes. Okay. So how so we ask that history is that how oftenly they are seeing it, and then also any provocative factors which they have noticed this after taking this they are having this problem, or after having any painkillers they are having any problem. So are they on some antihypertensives? Sometimes AC inhibitors the patient takes and they start developing, swelling. So we take the history of medicine also to the patient. So after looking all the histories, then we evaluate what could be the cause. So there's something called Urticaria Activity Score System, in which we ask the patient to, from for 1 week, within a day they have to calculate and tell us कि एक दिन में इतनी बार itching हुई और इतनी बार skin में swelling हुई, और वो 1 week तक वो follow करते हैं. We have a particular score. We evaluate कि patient को mild, moderate या severe form of urticaria. So this is how we diagnose it, and also we write down some blood investigations also to the patient, looking into the history. Basically, CBC, ESR, we definitely give. IgE level is important because a lot of eosinophils will be released. So that is sometimes IgG antibodies against eosinophils are there. So we check all those antibodies. Thyroid TPO antibodies we need to check for the patient. So we have to look what is the cause, and from the blood count, from the history, and then accordingly we go through the treatment.
Doctor, as we do some of the tests, do deficiency of vitamins causes urticaria, or does intake of vitamins help urticaria?
You know, you're absolutely correct. Vitamin deficiency can, aggravate your urticaria, but sometimes if you're allergic to some of the vitamins or some of the ingredient, can be the cause for urticaria. So it's again the very important part comes the history. Okay, so we have to evaluate the way the patient is, coming to us with the symptoms. We have to evaluate. Normally, vitamin deficiency is not that can a common cause for urticaria. Not that common cause for urticaria. But if patient has, so we give it to. Sometimes the patient are very, they take too much of a supplements. So I usually stop them and don't take too much of a supplement. That might even be a cause for urticaria.
Okay.
So it's both the way we have to look for.
Doctor, can urticaria be prevented naturally?
Yes. It can be prevented if you know your provocative factors, if you know which is the cause for your urticaria. But if it is not possible for you, then lifestyle modification, healthy lifestyle, if you take it, as I say, smoking, alcohol, if you just maybe the main cause sometime, for provoking those autoimmune cause as a source of allergen. So definitely, and with time, if your immunity, is better, then you can definitely your urticaria is a waning of time. So it's definitely a treatable one. Maybe it takes in some patients some years, but definitely.
Doctor, does urticaria makes someone tired if they are diagnosed with it?
Yes, definitely. Some patients' quality of life is really disturbed because they feel a lot of itching every time. Definitely, it disturbs. Once they've been diagnosed, they thought now how will will treat, how will get out of this treatment. But if you take a proper treatment, you follow the proper prescription of a doctor, it is definitely treatable.
Because of the individuals overthinking, oh, I'm diagnosed with urticaria, what I'm supposed to do, what I'm not supposed to do, which dermatology I should go, and what they'll help you out, what they'll not help you out. So this overthinking can make a person tired, right?
Yes. It definitely affects the quality of life. It's 100%.
So I think so. The doctor are the most concerned person who can help them out with the overthinking as to not stress up and feel calm, and you will be get treated well by the dermatologist. Yes, is there any dietary precautions or do's and don'ts for patients?
Yes. So do's and don'ts, as I've already saying from the first point, that we have to look for the common causes first. Okay. The common causes, like is the most common cause is the food, as you are also mentioning. Okay. So avoid outside food as much as possible because we don't know what we're having. Have more of a home-based food. I always say to my patient. Then second, if you're allergic to any particular allergen, if you know about it, avoid that allergen. So basically, this is there. And if you are allergic to cold, try to wear warm clothes. Avoid exposure of cold air at that time. If you are allergic to sometimes cold, so don't sit in just too much of a AC, so that you start developing your cold urticaria. And second, if you are allergic to UV light, so try to protect your body from wearing a full sleeves and while you're going outside. Because basically, if you have UV light allergy, it's not on face, neck, which is already exposed. Basically, the unexposed areas they get allergy fast. So wear the full sleeves. And second, if you're allergic to heat, avoid excessive heat. If you're sweating me, if it is there, then of course you're going to gym, then immediately take a bath and cool down your body. Okay. These are the do's and don'ts which you should know which is the provocative. If you're allergic to certain drug and medicine, don't take that medicine. You have to tell your doctor also when you're going for some treatment that doctor, I'm allergic to this medicine, already been diagnosed. So these factors, do's and don'ts which you have to keep in your mind before so that you can prevent further form of allergic reaction.
Doctor, is urticaria contagious?
No, no, not at all. As I said, it's just the allergens, antibodies forming, so it's an allergic reaction inside your body. So it's how your body is reacting to your allergens. It's not contagious at all.
Doctor, prior you mentioned about the COVID thing. Can COVID cause hives on face?
Maximum COVID causes
Can COVID cause hives on face?
hives on face.
Yes.
See, hives can be there on any part of your body.
Okay.
It's not just on the face. Yes, COVID initial starting is just the allergic reaction, urticaria like reaction. Yes, COVID can cause the allergic reaction. So you don't know, you didn't just come with an allergic reaction to your doctor that I'm having this. But simultaneously, you start developing cough and cold gradually. So that can be the initial urticaria, can be the initial stage of COVID 19.
Doctor, what are the lab tests are needed and why?
So lab test, as I said, after looking into the history, they give the complete blood count. Okay, in which I usually check the neutrophils, eosinophils, basophils levels. Okay, even the hemoglobin I used to check, and then ESR, any sort of recent infection the patient has. Then also IgE level, which is basically tells about the eosinophil level of the patient, the allergen, how much is the allergen in the body of the patient. Also check for thyroid because thyroid is also very common cause for the So I check TPO antibodies, and there is something called serum sickness, autologous serum, which we do for some patient to really diagnose the autoimmune cause, which our doctor.
Doctor, what are the treatment options available?
So the treatment basically now is the second generation antihistamines. We give that to this is the first line treatment, and we start with some dose of our antihistamines. And if we see that its patient needs to upgrade the dose, we upgrade the dose depending on how is the relief of the patient. And this is how we give the patient these antihistamines for some time, for maybe for 2 to 3 months. We give the antihistamines if there's an acute flare, as you asked me, if there's an emergency, then in that case, we sometimes give oral corticosteroids, okay, for 5 to 7 days, 3 to 7 days to counter the acute urticaria and then followed by the oral antihistamines for a longer time.
Doctor, as you mentioned about the treatments of injecting a steroid, does it have any side effects?
No. So as is only a short course of corticosteroid to counter that acute phase, to counter emergency, to handle the emergency, we just give it for 3 to 7 days, as I said, very short course, and then followed by our oral test.
Okay. All right. Thank you, doctor. I think the session has been very informative, and all our viewers are getting more interested to actually know what all is come up. And they have asked so many questions, and we have some viewers with questions. That is Advik Singh. His question is, what's the cause, and is it an allergy?
Yeah, so it's another form of allergy only. Okay, but in this, see what is happening. The wheels are coming on and off.
Mhm.
Okay, so you have a itching, you have a redness, you have a swelling for some time, and then either you take one tablet, it goes off, and it's not there
Mhm.
for some days, and it comes again.
Yeah.
Okay, so that phenomenon of on and off is known as urticarial wheals, and you develop those wheals. So, and in allergy, sometimes if you have contact dermatitis, so
Mhm.
that remains for to that area just redness. It doesn't come go and off. So that's the
Yeah.
basic difference of urticarial wheals. You know,
Mhm.
and the causes I have already mentioned. There
Yes.
are multiple causes.
Yes. Yes, thank you, doctor. We have Vandana Narvaya with us, and her question is: are there any dietary changes one should make to manage her chronic idiopathic urticaria?
Yes, definitely for chronic idiopathic urticaria. So, as I said, avoid any sort of packed foods.
Mm,
Chips and namkeens, all packed foods. Just avoid completely.
mhm,
Any coloring agents used in the food, avoid completely. Okay, and have a lot of fresh fruits, and I always say fresh vegetables, which have a lot of antioxidants, might help in improving, ultimately to improve the immunity, and we avoid
yes.
that allergic reactions which is happening there. Any source of allergens we have to prevent, attaching to the Ig receptors.
Mhm,
So there. So that dietary modification has to be there, along with
mhm,
I said smoking, alcohol that can aggravate any sort of painkillers. We are just avoid any sort of pain as much as possible, or under the guidance of a doctor.
mhm. Actually, that means to say, like, the one who is for diagnosed with urticaria, the one must avoid unhygienic food or fast food which is being
Yes.
packed and with like oily or anything else which is from the outside.
Uh,
Okay. We have Purvi Mehra, whose question is: are there different types of urticaria?
Yes. So see, there's a classification, as I said, acute and chronic. Acute means within 6 weeks, immediately, and chronic means after the 6 weeks, more than 1.5 months.
Mhm.
Also, in when we're talking about chronic urticaria, if it is more than a month or more than a 1.5 month, it is inducible, whether it's caused by certain known factors, as I said, dermographism, like heat urticaria, cold urticaria, sweat urticaria, this is it. Something which we cannot diagnose
Mhm.
completely, known as chronic spontaneous. It's happening, we don't know. It's idiopathic urticaria. So this is the basic classification.
Thank you, doctor. Doctor, we have Monica Sharma, whose question is: which food one should avoid if they have urticaria?
Yeah, so I've already mentioned this.
Yes, you have mentioned this. Yes. We have Rohit John, who has: what treatments can his doctor prescribe?
So, as I mentioned, the doctor should medicine is anti-pain. First line treatment is antihistamics. So we have to take a second generation antihistamics, and we have to also look for IgE level. How is the IgE level? Accordingly, we give the antihistamic, and we updose also the medications depending on how the symptom relief is there. So main medication is antihistamic for us. Then there's something called immunosuppressant like cyclosporin or
Yeah.
biologicals like omazilumab. But that I don't take as a first step. I
Mhm,
usually take it later if the symptoms are not under control by antihistamines.
mhm. Yeah. We have Ravi Kumar Singh. His question is, I think, in pregnancy, sometimes urticaria occurs. Which medicine you suggest in this condition?
So in pregnancy, we try to avoid, but if not, then loratadine is the one which I usually give to my patient. Sometimes to cetirizine also.
Mhm.
Okay, so loratadine is the one which is been the safest one to use during pregnancy.
So there is one more viewer whose question, the viewer has Abhishek, which molecules you prefer in chronic idiopathic urticaria and which is fast acting?
See, the fastest acting which I preferred is either the levocetirizine, fexofenadine, and also the recent one is the belastin.
Hmm.
And so these are the one which I really preferred when it comes to chronic edema. The fastest one is what I felt is fexofenadine.
Okay.
Other
Doctor, we have Komal also, whose question is she's facing last 1 month onwards urticaria. So how can she avoid facing after eating the food? She gets this types of symptoms. Like it's very often for her.
So, she has to see a dermatologist, and if she knows after having which food she's having an allergy, then she has to avoid that completely.
Mhm.
Okay? If she's
Uh,
aware of that food, she said,
mhm.
"No, after having food." So it's not that all food will give to urticaria. It's
Mhm.
not been possible at all.
Yeah.
So as I said, if you think after having, for example, potato, very common. I'm giving an example.
Yeah.
Avoid potato and see whether now your urticaria is there or not. So this
Yeah.
is one exclusion. You're just excluded. Like,
Mhm.
so this is where you can actually make it out which food is able to
Mhm.
diagnose it causing an allergy. If
Mhm.
not, then my suggestion is meet a dermatologist. We take a history. We'll try to look like is it a food or something else, and then accordingly we'll treat.
We have Monica Sharma, whose question is what causes urticaria to flare up more?
So you already have urticaria, but flare up can be a normal insect bite can flare up. If you are exposed to, immunity goes down because of some infection, also your urticaria can flare up.
Mhm.
And if you have helminthic infection, parasitic infection, so that also can flare up. Even any fungal infection can flare up.
Mhm.
If you go through any surgery, for example, then surgery again can leads to the flare up of urticaria. Common causes.
Oh,
So this is there. Then certain medication, if you have taken recently introduced any medication, can flare up your urticaria. So there are multiple causes.
so they have to check on their medications as well that may increase or let them help them reduce the urticaria as well. So we have Priya Sharma, whose question is why does urticaria flare up at night?
Yeah, as I said before, um, it's first and foremost our mind is relaxed at that time, so we feel a lot of itching because our concentration goes to itching.
Yeah.
Second, muscle deregulation has been seen more of after 6 o'clock. So sometimes we give the montelukast at evening time because of muscle deregulation. What is happening in urticaria is tissue muscle deregulation is there, and the circulating basophils. They release inflammatory mediators like cytokines, are there platelet activating factors, and histamine. So they are more released in the evening time, and then that's why. But basically, it's because of the relaxed mind.
Okay, so relaxations of mind might flare up of urticaria. Okay, we have Priyanka with us, and her question is how long do flare ups of urticaria last?
So, so the flare up, as I said, there are two forms of urticaria. One is acute, which is less than 6 weeks. But if it is chronic urticaria, if you're not, sometimes it is, it gets treated by itself. Your body is able to clear. Otherwise, it might take with treatment also 1 year or 2 years. Gradually, your body will clear. So that is the so I've seen there are a lot of variations from months to years.
Doctor, one last and the foremost questions I would like to ask for all our viewers and from my side that what is a giveaway advice to all our viewers for urticaria precautions and what all should be taken care to avoid urticaria diagnosis?
First and foremost, I say you should know whether you have urticaria or a normal allergic reaction. The difference should be there. So
Mhm.
if you're getting repeated allergy reaction, get it diagnosed whether it's urticaria or not. Don't just take pain medicine that it's just an allergic reaction and just taking a medicine and I'm fine. Don't do that. You should know that. Get it diagnosed whether if you have allergic reactions to urticaria or not. And when you've been diagnosed that you have urticaria reaction, follow the instruction of the dermatologist. The
Mhm.
medications, sometimes the patient, they just take medicine, they feel relief in 10 days and they leave the medication. But
Yes.
exactly that's not. You have to take a proper course of to get treat yourself from urticaria. It's not a 10 days course.
Mhm.
It's actually till you've been relieved from IG level is down, or till your dermatologist say now you can stop your urticaria, medication. Then only you stop it. That way you can treat your urticaria completely. And lastly, improve your immunity. So you can improve your immunity by good lifestyle, right? Having a good balanced diet, right? And reducing your stress level.
Yes. As you, all the viewers, as you know, that Dr. Chanchal has advised us with a lot of information about urticaria, and the most common thing which you have to do and take advice, as the doctor said, that if you are facing any of the allergy, get treated and please get diagnosis, treatment from a dermatologist after allergic reactions, and do have a dietary and a good healthy life. Thank you so much, Dr. Chanchal Choudhary, for your valuable time. It has been a very informative session for all our viewers, and I'm sure that they will use this information to prevent themselves and their near and dear ones from getting urticaria. And case if they get to see such symptoms, they know what have to be done and what self medication is better to approach a nearby dermatologist. It's great to hear from you, and we really look forward for many more sessions in the coming times for all our viewers. Thank you, viewers, for your participation in today's sessions. And to get latest updates on how to keep your skin healthy, do like and follow our FB page, All About Skin Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you so much, all the viewers. Thank you so much, Doctor. Have a great day ahead and take care of yourself.
Thank you, Riddhi. Thanks.
Thank you.